Good afternoon, everybody. Today is March 9th, 2020, and this is your SARS-CoV-2 coronavirus update for the day. And my question is, are there 49,000 cases in the USA undetected? I think it might actually be the case, and I'll go over some statistics and numbers here. We're really running out of time. I believe that the United States is going to see a drastic increase in the amount of cases here very soon, but we'll see how that all turns out. So let's get into it. So right now the cases around the world are growing at a very scary pace. As of the last recording on on March 7th, there were 104,000 cases. Now there are 114. There were 3,500 deaths. Now there's over 4,000. There were 58,000 people recovered. Now there's 62, but that really doesn't change a lot as far as the numbers go. You expect that with the increase in deaths, there's going to be an increase in recoveries as well. So since we recorded last 2 days ago, there's been nearly 10,000 cases added around the globe. Nearly 500 deaths. There's 478 added. There's been 4,275 recoveries, and the serious and critical condition number has gone down. And I would expect it to go down because of the influx of the amount of cases that we are getting. Most of those people, they haven't gotten to that serious or critical state. So I do believe that the serious critical number is anywhere from 15-20% like we've been seeing. But as there are more cases added, this disease takes 2 to 3 weeks to get over, to either die or be discharged. So really, we'll know more accurately once this thing peaks and it is no longer growing at the rate that it's growing. So that is the cases growing around the world over the last 2 days. Now, as of today, right now, these are all of the countries who are the hardest hit. And as you can see right now, the United States has 624 cases. They've added 83 today, with a total of 22 deaths. So the amount of deaths is lower than expected, but the reason why that is because we've seen this number grow over the last week from double digits to now triple digits, soon to be quadruple digits. What I find interesting is worldometers.info actually added this total cases to 1 million population. And Italy and South Korea have been doing heavy testing. As you can see, they are the two most tested in the world. They've done the most amount of tests compared to anybody, except for probably China, but I don't see those numbers on here. So South Korea, as of March 2nd, did 109,000 tests. We know that they've done more since then. Italy did 23,000. As of March 2nd, right here, the United States has only done 472, and that's a very low number. The CDC 2 days ago, so on the 7th, said that only 1,583 people had been tested for the coronavirus up to then. So as you can see here, in Italy, South Korea, we see about 150 or so people per million that have been tested positive for the novel coronavirus. Now, this thing took off at the same time in Wuhan, China. And with how global the world is connected, how global the whole industry, people fly more, people travel more, everybody is all over the place. And the United States is one of the most heavily traveled to countries in the world. So that would lead me to believe that if these two countries are testing and they're seeing 151 cases per million, then the United States should be roughly around the same amount of number. So if South Korea has, 0.01517% of their population, or million population, have this disease, then we're looking at the United States at about 327 million people. That equates out to roughly 49,000 people who should be infected if these numbers are similar in the United States, which is right here, 1.9 people per million. So for every case out there, is potentially 143 to 149 people that are undetected at the moment spreading this disease around the United States. The United States has to test more. They need to get on top of this. I unfortunately feel like the United States, and I do believe this, is putting the economy ahead of their citizens' health and wellness. They don't want to make people panic. They don't want to lose control of the population. So they're purposely slowing down the testing, or perhaps it's a mistake. But either way, if these numbers are correct and there's any sort of reflection in the United States, there could be up to 49,000 possible cases in the United States right now going undetected, which actually does make sense, seeing as there are countries that are getting their first cases, and those people traveled to the United States. There are states that are getting first cases, and the people did not travel abroad. They traveled to Miami, or they traveled to, or I don't know about Miami, but they traveled to Florida, or they traveled to California, or they traveled to who knows where. This is a big problem, because if these virus cases are going undetected in the United States, then they're being transmitted to people, and with an incubation period of anywhere from 2 to 24 days, and being asymptomatic spread, you don't know if the person you're talking to at the grocery store is sick. And if they are sick, how many people do they engage with every day and come in close contact with? It's a huge problem, and it needs to be resolved immediately. The governments around the world are quarantining millions. I mean, China's quarantined people, Korea's quarantined people, but Italy just recently did this. And what they did, they locked down the whole northern Italy area. 16 days after the beginning of the outbreak is when it took place. So what that means is in northern Italy, there is no travel in or out of the area, as well as within the area. The only thing that they're allowed to do is duly verified professional requirements, emergency situations, or for health reasons. People with symptoms are strongly encouraged to stay home and limit their social contact as much as possible, and then contact their doctor. They're telling people to avoid gathering with each other. All schools and universities are closed down. I believe it's until April 2nd that they are closed down till. All museums are closed, places of culture, cultural, religious, or festive events are suspended. Movie theaters, bars, regular, amphitheaters with dancing, dance schools, game rooms, casinos, nightclubs, and on are going to remain closed. There's no sporting events, no going to the swimming pool, baths, wellness centers, gymnasiums, they're all closing down. Bars and restaurants can remain open from 8 until 6, but they have to have the safety distance of at least 1 meter between customers. That's about 3 feet between different customers. Shopping centers, department stores are closed. Places of worship are open, so people can still go to church, but they have to maintain 3 feet between each other. And marriages, baptisms, ceremonies of the like are prohibited until further notice. As in the north of the country, cinemas, theaters, museums, pubs, game rooms, dance schools, discos, and other similar places are closed all across the country, so just not the northern region. And all sporting events are suspended with some exceptions, just few exceptions here. And I expect similar measures within the United States in the coming weeks and months. We're already starting to see it in Washington State, which has the most amount of cases in the United States. But I feel Washington State, New York City, California, we're going to start seeing people be told to stay home. So it is coming. You need to prepare yourself, and you need to understand that this is not the flu. This is something that's very serious. The governments are taking it seriously. You just need to watch what they're doing instead of listen to what they're saying. Complacency and lack of knowledge in this are very, very dangerous. The CDC is recommending that Americans over 60 should stock up on food and medicines and avoid venturing out as the coronavirus spreads. People over 60, the CDC is recommending that they already start to self-isolate themselves and prepare for long-term isolation, really. But here's the thing, over 60 Americans won't be the only ones who should be stocking up. Everyone needs to stock up. Everybody needs to have at least 3 months worth of food and supplies. I recommend 6 months worth of food and supplies. We don't know how long this is going to go, but this virus takes anywhere from 1.5 to 2 months from the time that somebody is infected to the time that they recover. It's a long time. So we need to be prepared to stay away from people for a long time, working from home. And the problem with complacency and lack of knowledge is just this. Family of Missouri's first coronavirus patient broke self-quarantine and attended school dance. They went to a dance. Instead of listening to the government, they called them up and said, hey, your other daughter has this coronavirus. You need to quarantine yourself and stay isolated and not go to public places. And what did they do? An hour later, they went to a school dance and potentially exposed hundreds of people, innocent children, who are going to potentially infect their families. This is a huge problem. But if the media and the government is saying, oh, well, it's not a big deal, only 2% are going to die, it only affects the elderly, it's just like the flu, it's mostly mild, it's not a big deal, then we're going to see this time and time again. People are not going to listen to it because they're not going to take it seriously. I think that people are starting to wake up, but it's still difficult. There's reports of doctors saying that they don't think it's a big deal and they're not taking it serious. My wife went to the doctor and they told her masks don't work and they don't think it's a big deal. That was a doctor's office. She's 9 months pregnant, about to give birth. This is a huge, huge problem. And right here, it took me 3 emergency room visits to get a coronavirus test in New York. It took this person 3 different emergency rooms. I don't know if they had the virus. I did not read the article, but I just saw this headline. If these people are going to multiple different emergency rooms trying to get a test, then they are exposing all 3 of those emergency rooms to this coronavirus. All of the patients, all of the medical workers that they have interacted with, all of them are being exposed. If the person has it, that is a huge, huge problem. The reason why nobody's wanting to test is because they don't think it's a big deal, and they've been told and brainwashed that it's not as bad as people are making out to be. It's people just being alarmist, people being fearmongers. It's just the flu. The flu kills more people. Well, the flu's been around forever. This thing just appeared. And in a few short months, it has infected at least 111,000 people. It's a big deal. Right here, from NPR, coronavirus. Many people in U.S. will be exposed to virus. Many people in U.S. will be exposed to virus at some point, CDC says. Many people is probably a majority of people. One of the reasons why is because nobody is taking it seriously. Fulton County Schools teacher tests positive for coronavirus. Schools closed Tuesday. That was an hour before I put this together. This is very, very recent. This is the reason why they need to close schools immediately for at least the next month. Because I'm not afraid of children getting sick and dying necessarily. Do I think that 0% of kids who get it die? No, I think that there are children who get it and die, and there have been, and they just haven't been reported. But kids, schools are a petri dish. They are going to get it, bring it home, and give it to their parents. And their parents aren't kids. Their parents might have underlying health issues. And this thing has the potential of orphaning many, many children. If we do not close schools as soon as possible, then we're going to see an exponentially larger outbreak than we could have if we don't. Right here, Lower Merion cancels class after students, staff may have been exposed to CHOP doctor with coronavirus. This is in New Jersey. Coronavirus versus flu. It's just like other viruses, and we should go about our normal business, right? Wrong. This is probably one of the first articles I have seen where the media is finally starting to tell people that this is not just the flu, and it's a bigger deal than the flu. But there's also Many more articles out there still saying that the flu kills more people. Even the president said it. Comparing this to the flu is just a recipe for disaster. Avon schools closed 2 weeks as second student displays symptoms of coronavirus. We need to close down the schools immediately. If you have children in the schools, you may as well pull them out, stay home with them for a week, and just see what happens. A week or two. It's not worth the risk for your child to go to school, to bring this home. And I have a feeling that within the next couple of weeks to the next month, all schools in the United States are going to be shut down because it's necessary to stop the spread of this illness. The reason why they're hesitant to is because some parents don't have the ability to work from home, and some parents don't have anywhere that they can send their kids. But that is not a good excuse. That is not a good reason to put everyone's lives at risk. We need to do our part, and you can do your part. This disease won't be the end of the world, but we can help by doing our part. Listen, you need to prepare you and your family for isolation and social distancing, voluntary or mandatory. You need to stock up on at least 3 to 6 months worth of supplies: food, water, medicine, toilet paper, supplements to keep your immune system up. If you're sick, you need to stay home. Do not go to work if you are sick. If you have the ability to work from home, you need to do it immediately. And you need to limit your exposure to the public. Don't go to events, don't go to crowded spaces. Get enough food for the next 3 months and sit at home and don't leave. And please, 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 for the love of God, do not travel. Do not take buses, trains, boats, or airplanes. You need to drive yourself if you go anywhere, or have somebody drive you if you need to go somewhere. And please, take your children out of school. If everyone takes their kids out of school, the schools would be forced to close down. We need to take everybody out of school to stop the spread. If an adult gets sick and gives it to their kid is going to go and get all of the children sick, and then that child is going to basically infect all of the parents. This needs to happen, and it needs to happen immediately if we want to turn the tides on this thing so we can go back to normal life. The stock market is tanking. People are starting to realize the severity of this. The panic buying is starting. If you haven't stocked up, you need to do it now, and you need to go out and you need to buy enough supplies to be able to weather the storm. If we do all of these things together, then we can make it through this together. You need to go out and you need to take this seriously. Conclusions: cases are growing throughout the world, and they're only going to grow faster. The media and the government, they are trying to keep people calm and keep the economy going. You need to prepare for eventual voluntary or mandatory forced isolation. You don't want to be caught without food. You need to wash your hands regularly and try to prevent yourself from touching your face so you don't get sick. If you have a fever, if you think you have a fever, you have a dry cough, sore throat, and you believe you may have this virus, the SARS-CoV-2, COVID-19, do not go to the hospital. You need to call them first, and they will give you proper instructions. Going to the hospital without notice is going to expose others unnecessarily, like the individual who went to 3 different ERs just to get a test. We do not need to expose everybody, and we do not. If we go around each other, that is how it spreads. We need to distance ourselves socially, as the CDC has said. So this is your coronavirus SARS-CoV-2 update for the day. This is March 9th, 2020. I hope this helped.